So if you can hear this, and you're outside of the curtains, if you could kindly come and join us for CAFOs, or if not, could you kindly be quiet so that folks in here can hear exactly what we're trying to talk about. Ladies and gentlemen, welcome, and it's obviously an incredible event with an amazing amount of intellectual capital and an amazing amount of incredible information. Just a sort of a little project that we could get up to. If we could all now just sort of defecate and urinate where we sit, and we could do that for 45 days, and then we could walk around it in a little bit. You can imagine what, in some cases, it's like to live on or in a CAFO. Because a CAFO, by definition, is a confined animal feeding operation where an animal is confined for more than 45 days during the growing season. CAFOs start at around 700, 750. There are different numerical quantifiers dependent on species as what is defined as a CAFO. It's an incredibly complicated setup, but the main phrase is in excess of 1,000 animals confined for 45 days or more. But some of our CAFOs go to 30 to 50,000 dairy cattle, living with 29,999 of their best friends, 100,000 beef cattle, living with 999,999 of their best friends, and 40,000 chickens, living with 39,999 of their best friends. And the analogy I use when I think about CAFOs and why they matter, and I want to be really clear, this panel is not anti-agriculture. It is not anti-food animal production. Food animals have a role to play in a sustainable future. We have an obligation to provide an environment and a situation where those animals can thrive, be themselves, and meet their natural needs. Behaviors have a need and a want. I have a need to eat. I have a want to go to Hawaii. I'm entitled to eat. I don't think I'm entitled to go to Hawaii unless I earn the money. So needs and wants. We have an incredible panel in front of us, and they're going to talk about some of the externalities. They only have 10 minutes, so I want to be as quick as I can. One of the externalities that is missing here is the human externality for people of color and people of diversity and for the various genders. But those are a minority that aren't being heard, particularly in the US right now. People who work on confinement operations invariably don't have healthcare plans. They don't have 401ks. Some of them don't even have a license to be in the United Kingdom. Good grief, the United States. I had so many English folks at my Americans going. I've been here 11 years and I think of myself as an American, but all the Brits are like killing me. And I apologize. So we're going to start with, and I have to read these to get them correct. Kendra Kimbirauskas, who's been somebody I've known for the longest time, and she does incredible work, initially through an NGO in Oregon where she Friends of Family Farmers, and they did some incredible work just on a more local level, looking at how farmers could go forward. But more recently, Kendra has become executive director of SRAP, which is it's a socially responsible agricultural project. And what Kendra's organization does is actually an incredible piece of work. She works with communities to fight CAFOs coming in, or to make CAFOs a better space as they come in, by empowering the community rather than being a national organization coming in over the top. She shares the tools to make that happen. So without any further ado, Kendra.
Thank you, everybody. Well, first and foremost, thank you for that, Andrew, and I want to thank the organizers of this conference for bringing us all together to have these really important conversations. This is can you guys hear me without the mic? No? Okay. This is a really important dialogue, and I'm really glad to be sharing in the discussions with all of you. First and foremost, I am a farmer. I have been around agriculture all of my life. I grew up on a farm in Michigan. It was a dairy farm. And I moved westward, and I now farm with my husband on 70 acres in Lynn County, Oregon. We raise a variety of livestock on pasture, and we direct market our products to up and down the I-5 corridor, but mostly in the Willamette Valley of Oregon. But in addition to farming, I'm also the Chief Executive Officer of the Socially Responsible Agricultural Project. We call it SRAP for short. And that is the capacity that I'm here to speak to you today. I've been asked to talk about the costs of CAFOs on rural communities, and before I can do that, I want to tell you a little bit about our organization and the work that we do. SRAP, I think, is the only organization doing what we do in this country. We basically work with communities who are on the front lines of factory farm expansion. So these are communities who have been threatened by a proposed factory farm. They find out what's happening, they look for help, and they find us. And we have a team, a staff of about 20 people. These are some of my colleagues here. And beyond these 20 people, we have a network of folks all across the country that we work with when a new facility comes in. Our team is unique because, unlike some other organizations, our folks didn't study to do the work that they're doing. The majority of the people, and we have farmers and ranchers and engineers and lawyers, they actually were living in a community themselves, and they had their life disrupted when a factory farm came to town. And they made a pledge after they learned what happened to their community that they were going to commit their careers to helping others that were in the same situation. Oops. So I want to talk a little bit about what we're talking about when we talk about factory farms. This is not Old MacDonald's farm. This is not red barns with cute little animals outside on pasture. These are massive industrial operations that have removed the animals from the land and brought them inside, and as a consequence, they have to manage the waste. And I want to be clear with you that for the majority of the people that we work with in rural communities, it's the handling and often the mishandling of the waste that causes the problems. So these giant lagoons, just to talk about this picture, the barns, this is a hog operation in North Carolina. Each one of those barns has roughly 2,500 hogs in it. Those giant lagoons that look like ponds are no ponds, they're no lagoons. They're giant cesspits where the waste is flushed out of the building to left and sit and decompose in these pits until they can be spread onto the field. And so when waste is put on fields, now we have to remember that animal waste is an important component of the holistic farm system, right? Like, animal waste has been used for generations to ensure that crops get the proper nutrients in order to thrive. But when waste is applied to a farm field above what they call agronomic rates, which is the rate that the plant can take up the waste and utilize it, it no longer is a nutrient for the plant. It becomes potential pollution. And so that waste can run off, or if the waste is applied using a bad practice, such as spreading in the rain in this picture, or just simply over-applying or dumping, that waste will end up getting into the waterways. And when waste gets into the waterways, it pollutes our rivers, our streams, our lakes. Those waters can become unfishable, unswimmable, and sometimes uninhabitable for aquatic species. In addition, when manure gets into the water, it can pollute the groundwater. So when people live in rural communities, they live with a domestic well, which is usually their sole drinking source for water or even for any use of water. It's a well, and when those wells become polluted, they become unusable, and that's a real problem for people living in rural communities. When the ponds that you saw have the waste decomposing and sitting in them, we know that they off-gas, and we know that there are 160 toxic gases in the emissions that are coming off animal waste lagoons. Some of the gases that you might be familiar with are hydrogen sulfide, methane, ammonia, carbon dioxide, and carbon monoxide. And these are gases that just aren't non-aesthetically pleasing, they're gases that can actually hurt you. Hydrogen sulfide can kill you if you breathe it in at high enough concentrations. This is one of our clients. This is Todd Knudsen. He lives in Argyle, Wisconsin. He had 2,400 hogs move in just under 900 feet from his property line. He's a retired firefighter, and the gases from the lagoon or from the pits from this barn are so overpowering that on summer days he cannot enjoy his yard without wearing his oxygen mask. He also can no longer open his windows. So another way that CAFOs can harm communities with their waste disposal is is what we see in arid communities in the United States. Unlike places that have a lot of water, where they use the water to flush the manure into the giant pits, in arid places, such as in Arlington, Arizona, they'll often scrape the manure out and let it decompose and let it pile up and compost down, which generally speaking, composting is a good thing, but not when you have the waste dry out and the waste can be carried in the wind to the people's homes that live in the same vicinity. This is Hickman Family Farms in Arlington, Arizona. The top picture here is not, these piles are not on fire. This is the wind carrying manure from this facility into the area. I was out here, I took these pictures. There were kids getting off the bus on their first day of school with their new school clothes, running to their houses, covering their face so that they could get out of this, this blowing waste. And in this particular case, the Hickman operation, in addition to composting the manure, they compost their dead chickens. So you've got dead chickens, manure, feathers, and all the pathogens that go along with that, blowing in the wind and getting into neighboring areas. I did. So I want to tell you a little story. This is Hubert Brummett. He's from Indiana, and he's a hero. He was a veteran. He survived World War II. He's 94 years old now. I think that slide says 93. But he came back from the military. He started a farm. He started a grocery store. He retired. He has his little place of paradise in rural Indiana. And he basically he has COPD, which is a pulmonary disorder. And his favorite thing to do is to sit on his porch in the afternoon and just swing on his swing. A couple of years ago, we found out that there were 4,000 hogs that were looking to site on the property adjacent to Hubert's property, and they were going to put the manure lagoon 557 feet from his porch. Now, in his final years of his life, he's no longer able to just relax and enjoy life. He's worried about whether or not he's going to be removed from his home and put into a nursing home because he's not going to be able to breathe if he stays in his house if the hog facility goes in. This is Lynn and Nancy Utash. Lynn and Nancy are pasture-based beef farmers in Wisconsin. In their community, there are 20,000 people. There are almost 80,000 cows. 50% of those cows are in confinement buildings, and in their county, 34% of the wells in that county are so polluted with E. coli and or nitrates that the water is not only undrinkable, but it is unusable. That means you can't brush your teeth, you can't give the water to your dog, you probably shouldn't even be bathing in it. And so this is just another example of how these industrial farms harm our rural communities. So I can stand here and I can tell you some facts. We know that there has been research that has been done where if a factory farm comes into a community, that approximately between 1.5 and 3 family farmers will be displaced. We know that factory farms who have a gross annual sales of over $900,000 spend less than 20% on the goods that they purchase in the local community. We know that those farms that are sustainable, that they purchase sustainable grossing under $100,000 in sales, they purchase almost 95% of the local goods from their local community. But what I would ask you all to think about is, what is the price? What is that monetary number when somebody can no longer use their yard because the stench is so bad? Their grandkids will not come over to their homes because the home smells like cow poop. What is that number? And I want to just close today by saying that there's a lot of really cool things happening in the good food movement. People are doing some really creative, awesome, amazing things, and we have to continue that work. But I would ask you to please remember that for the people living in rural communities, things are not getting better. It's getting worse when it comes to factory farm expansion. And we can't forget that these people also need our help and our resources. So thank you very much.
Kendra, thank you. I just had a quick follow-up question. Is there anything that we might want to know about Hickman Family Farms in terms of an unintended consequence, my favorite statement? that Hickman Family Farms is in fact a cage-free egg operation. So as we're moving away from cages, we're developing other unintended consequences. We may have improved the human perception of the welfare of millions of chickens, but now we've got a human cost to that change as well. So we have to be really careful as we're looking to reform agriculture of some of the consequences of some of the campaigns and work that we do. Kendra, thank you very much. Keeve Nachman, for many of you that have been around this for the longest time, an assistant professor of the Department of Environmental Health. Can we put the, would you be so kind? Thank you. At Johns Hopkins Bloomberg School of Health, an incredible school working on many, many issues around agricultural policy and some of the consequences, outcomes, or if you will, externalized costs of food animal production. And one of the things we managed to do when we put our animals inside was to make them permanently unwell, or to make their stomachs, rumens, and otherwise not function as well as we could. And what we did then was we introduced just a little bit of antibiotic into the feed. And by constantly feeding antibiotics at a subtherapeutic level, we've allowed the bacteria themselves to have a big S on their chest. They've become super bacteria, and they are in fact considered to be one of the greatest threats to food security in the United States and globally. So, Keeve Nachman, thank you.
Thank you, Andrew. Can you guys hear me okay? I'm really happy to be here today. Thanks again to Andrew, to Patrick, Sustainable Food Trust, and all of my co-panelists. It's really an honor. So I'm going to talk about one of the symptoms of CAFOs. It's one of the more complex issues to sift through. It's not explained very well when it's talked about in the public forum, and hopefully I can cut through some of that and make sense of it for you. I do want to be clear that this is just one of the many symptoms of CAFOs, and even if we were to solve this one, there'd be some great public health benefits to taking that action, but I think it would not solve the overarching problem. So please understand the narrow scope of what I'm going to be talking about today. So I think many of you have heard bits and pieces about antibiotic resistance. I know it was mentioned in many of the plenary sessions. So I'm not going to spend too much time giving you the background, but let me just give you quite a little bit. So we are routinely using antibiotics in animal agriculture. There are many different names for the different types of uses. The problematic types of uses that I'm going to be talking mostly about today are uses for purposes of growth promotion. And in the U.S., we're stopping using that term, and we're starting to call the same types of uses disease prevention. And I will later talk about why that's problematic. We don't have a separate group of antibiotics that we use for animals for the most part. We are primarily relying on the same antibiotics that we would use to treat infections in people, and if not those very same drugs within the same classes that ultimately work the same way. What happens when we use these drugs in the animal production setting is that bacteria that are present on those farms can learn to become resistant to those drugs, which would mean that when you or I become infected with those bacteria, the drugs we typically rely on to get healthy are no longer going to work. And what happens, unfortunately, is that bacteria are very mobile. They don't like to stay on the farm, and they find lots of different ways to get to people, including you and me. I think it's tempting to worry about ourselves. I like to worry about myself and my own well-being. But in studying this issue and thinking about CAFOs, I've come to recognize the importance of really thinking through who is most burdened with the problems that stem from CAFOs. And in the context of antibiotics, just like many of the other contexts you'll hear about today, people in rural communities, especially those who work in these facilities, are at greatest risk of exposure to these resistant bacteria, and thus are carrying the greatest burden of infection. So when you get an infection with a resistant bacterium, they're really challenging to treat. And what may happen is that we'll try one antibiotic, it will fail, your infection will worsen, and we'll have to try another. And sometimes that may happen a couple of times. And ideally, we'll eventually find the right antibiotic, but all the while we've accrued a very expensive and very long medical stay. What we've learned over time is that our tools to treat infections, our antibiotics, in many cases their effectiveness is waning, and we're not in the business right now, unfortunately, of developing new antibiotics to deal with these multi-drug resistant bugs. And You may have heard over the past couple of years that the Food and Drug Administration, who's our federal agency that's responsible for overseeing development and use of these drugs, they've come in with some approaches to remedy misuse of antibiotics in animal agriculture. And while that would really be the subject of its own separate talk, I will give you my opinion, and maybe the Q&A we can dig into this deeper. The FDA plan for addressing antibiotic misuse is not going to work. So, let's talk about burden. Okay, a little bit of the science very quickly behind what the phenomenon is that we're actually talking about. So let's imagine these purple guys and that one teal guy. These are bacteria that are present on a farm or in the gut of an animal. The purple ones are susceptible to antibiotics, especially the one that we're going to administer here in yellow. The teal guy, unfortunately, has a gene that allows him to survive in the presence of this drug. Okay, so we apply the drug. And what happens? All the purple guys are dead. They're all gone, right? I wish I had a little tombstone with the purple guys lying under it, but I don't. So the teal guy here, remember, he's the one that has the gene that allows him to survive. Nothing happened to him. And what he does is he takes advantage of the microbial ecosystem and reproduces. And what we're left with are a pool of resistant bacteria. And what happens is that we're actually not only giving a single drug, but we may be giving multiple drugs at the same time, and we're selecting, if you will, for bacteria that can survive in the presence of multiple drugs. So when you become infected with one of those bacteria, it's really a problem to treat you. Okay, so this conference is all about figuring out what the societal burden is and maybe even putting a dollar value on it. And I'm going to cop out right now. We can't do that, okay? But what I do want to say up front is that what we know about antibiotic use in animal agriculture suggests that it may be responsible for a significant portion of the overall burden of resistant infections in people, not just in the US, but globally. But what I will say as a corollary statement is that we unfortunately, I keep saying unfortunately, but it is truly unfortunate, we don't have the data to quantify the externalized societal costs that come from the misuse of these life-saving drugs. Okay. So let's talk about antimicrobial resistance and its burden in the U.S. and in the world. What I have to say up front is that there are no estimates that are credible of the contribution of misuse in animal agriculture as compared to the contribution from misuse in clinical medicine. I need to state very clearly that antibiotics are not used fully responsibly in clinical medicine across the board. There are many programs in place that are trying to improve the way these drugs are used in the clinic, and some are showing some progress. I would argue that we're not seeing similar progress in the animal sector. But the overall burden of both of those types of resistant infections have been estimated by the Centers for Disease Control and Prevention. And each year in the U.S., CDC has estimated that about 2 million people develop antibiotic-resistant infections that require treatment, and of those, about 23,000 people die each year, annual. And this is really, even CDC will acknowledge this is an underestimate. These are the confirmed cases when they've actually gone back and figured out, yes, this was caused by a resistant bug. CDC has also estimated that 20% of those illnesses and deaths are attributable to foodborne bacteria, which is not quite the same thing as bacteria that originate from farms, but it helps us at least try and envision how much of this might be related to agriculture. There are a number of economic burden estimates. I don't trust any of them, but I think what's important to do is look at the order of magnitude. So there really is no standardized way to do this, and lots of people have approached it different ways. But some of the most recent numbers I've seen is that the direct health costs associated with treating resistant infections are on the order of $20 billion US, and that doesn't include the life interruption productivity drain that's been attributed at about $35 billion US, and that's just the US. And again, we can't differentiate the clinical versus animal cost. The global burden has also been estimated, and I think this is where things get wildly uncertain, but the number that's been put on that is about $100 trillion each year, and about 10 million deaths attributable. So I guess the point I would want you to come away with from this slide is that this is a huge societal burden, and I believe, and I'm going to show you on subsequent slides, why I think the animal misuse is a big part of it. Okay, let's talk about how drugs are used in people versus how they're used in animals. So let's start with responsible clinical medicine. Remember, it's not fully this way, but hopefully most of it is, and we're moving in that direction. When we use drugs in humans, we only give them at therapeutic doses, so doses that are sufficient to kill bacteria. When you take antibiotics, you're usually not taking them for the majority of your lifespan, right? Hopefully, like 7 days, maybe a month on the higher end of things. So it's a defined duration of time. We can't get antibiotics here without talking to a doctor and having a doctor prescribe them, or at least we're not supposed to. And ideally, again, in clinical practice, the antibiotic that we get that is prescribed to us by a physician is targeted to treat a specific illness, or at least what we believe the bug to be. Okay, now we're going to talk about animals. All right, so the dose ranges of these drugs, when they're given for disease prevention or formerly growth promotion, they're subtherapeutic, meaning they're not high enough to treat an infection. Research has shown, and some investigative reporting has shown, that many of these animals receive antibiotics for the majority of their lifespan. Usually they'll stop a couple of days out to make sure that residues don't accumulate in meat, but much of the animal's lifespan. For the longest time, these drugs have been available to farmers over the counter, although things are shifting now, thanks to what FDA is doing, to be mostly veterinarian prescribed. That's not a silver bullet either. Unfortunately, many veterinarians work for the companies who make the decisions to use the drugs, and thus they're prescribing them in the same way that they used to be used. And lastly, when you're using antibiotics preventively, you don't know what bacteria you're trying to treat, so there's no way to target it. So I guess the point to take away from this slide is that the way that we're using drugs in animals is putting much more selection pressure on bacteria to convert them from the susceptible bacteria that we talked about before to the resistant ones. And now I'm running out of time. Okay, so here's what we'd like to know to assign the burden. In an ideal scenario, we'd be able to put a number on it. We need to know how antibiotics are used in animals. We are not collecting use data at all. We are collecting sales data. We are collecting very patchy data about certain types of uses, but it's not all that helpful. We want to know genetically what bacteria on food animals and what bacteria in the environment around food animals looks like, so we can make comparisons of those bacteria with the bacteria we get from people who present with clinical infections. Then we can start saying, okay, we know your infection originated on a farm. And if we had that, we could make those linkages. So here's what we're actually collecting. I mentioned that we only have sales data and not use data, and that's not really helpful because it doesn't tell us where use is happening, what species, what drugs, etc. To a very, very limited extent, there's one federal program that's collecting bacteria from the places I described. It's not a very comprehensive program. It's a start, but we're really not at the point of sophistication we'd need to be to really truly say anything about assigning burden. So I think we do have opportunities to collect better data. Some of our federal agencies like FDA and USDA have said we need to do a better job with data collection about antibiotic use, but they also complain that no one funds us to do it, so it's not going to happen. The tools to do that genetic comparison that I keep talking about are evolving. They're getting much, much better, and they're cheaper now, but we're not putting them into practice the way we need to, and there are huge, huge political barriers to doing so, and so that is a major opportunity. I'm almost done. And so my conclusions here, again, I'm going to restate my cop-out, is that we cannot assign a number in terms of the quantitative burden of antimicrobial resistant infections to animals. And the reason for that, again, is that we just aren't collecting the data we need to do it, and we're having trouble getting past some of those political roadblocks to doing so. But I guess my final closing point is I don't really think having that number is going to change anything. I think it would be nice to have it. It'd be a helpful talking point, but maybe it would focus the debate on the number itself and not on how to solve the problem. So if I leave you with anything, it's we need to actually move on this rather than try and worry about whether it's 35% or 65%. So thanks for your attention.
Keeve, thank you. Next presentation, if you may. So I'm very good at butchering people's names, so I think I pronounce it Aneja. Thank you. Dr. Aneja is professor of the Department of Marine and Earth Atmospheric Science in North Carolina State University. But I think more importantly, he's among the most prominent advisors to the U.S. Secretary of Agriculture on air quality, which is where the majority of his work is around. He's published over 170 scientific papers, 127 book chapters, proceedings of 47 technical reports, and this may not be a good thing. You actually hold some US patents. I'm not convinced in agriculture that holding a patent allows everybody to have their food, but you also hold 5 US patents. Patents should be. So we're going to hear a little bit today about the research and about the CAFOs on air quality and some of the outcomes of that air quality. And if we see the dust that Kendra kindly showed us there is research showing that some of these antimicrobial resistant bacteria are in fact around feedlots being carried in the dust and therefore into people's homes, food, onto buses and other things. So the air quality is a critical part of one of the externalized costs of CAFO production.
Thank you, Andrew, and good afternoon. What I'll share with you today is the science behind CAFOs, i.e. what are the different trace gases that are emitted from the CAFO operations, most specifically hog CAFO operations. And I will end with what are some of the challenges that we are confronting. And principally amongst them is moving this debate in another direction, which is the role of these trace gases on human health, which will be followed by the speaker after me. Okay, so.
You push the down button.
The button's not working because of that window that's open.
No, I'm ready to go.
I think.
Okay, this is what the shape of U.S. agricultural looked like. Family-owned farms with pastoral landscapes, a few animals running around, and everything looked wonderful. And in fact, the industry had us convinced that it was a benign green industry. And it is anything else but that. So what is the shape of agriculture today? It is industrial farming. The land holdings have all been brought together to an industrial way to do farming, whether it is crop agriculture or it is animal agriculture. And I do distinguish. There is crop agriculture that use vast amount of synthetic fertilizer and vast amounts of pesticides and insecticides, and animal agriculture, which are grown in concentrated animal feed operations. And so this is what the face of U.S. agriculture is today. Not that. It is no longer benign in terms of environmental issues, in terms of host of other issues. We go to these operations and we make measurements of trace gases or gases and particulate matter with the help of a mobile laboratory, from lagoons, from exhaust from the barns, make measurements of all sorts of different things, and then try to analyze our results and put them in some perspective for scientific analysis. Okay, so what is being emitted by animal agricultural operations or concentrated animal agricultural operations? Principally amongst them is ammonia. 80% of all the ammonia that is emitted in the U.S. atmosphere is from agriculture. Nitrogen oxides, 20% in the U.S. Reduced sulfur compounds, which the first speaker alluded to, principally as hydrogen sulfide, methyl mercaptan. These are very nauseous smelling gases which are emitted by agricultural operations, and we simply don't have a full handle on it. PM 2.5, about 16% is emitted by agricultural operations, both crop and animal. PM 10 is 18% from agricultural operations. Methane, 29% of all the methane, which is a greenhouse gas, which is emitted in the U.S. atmosphere, is from agricultural operations. Yes, thank you for that. Thank you. PM stands for, it's an acronym that stands for particulate matter. Okay, so just let me calibrate you. The diameter of human hair, do you know what that is? The diameter of human hair is about 70 to 75 microns in size. And PM 2.5 means particulate matter in the atmosphere, which is 2.5. So it's full or almost an order of magnitude smaller than the diameter of human hair. And
Pollutants that create actual residue in general air that you would see as not totally clear air. It would actually be visible in the eye as a particulate.
Okay. PM, particulate matter, is only one of the pollutants in the ambient air. There are all sorts of other pollutants that I'm listing here, but it is PM 2.5 is one of the pollutants that has a direct human health consequence. Is if you are above a certain concentration value, then it has a direct human impact on human health, as I will show you in just a minute. PM 10 is particulate matter. PM stands for, again, particulate, with an aerodynamic diameter less than 10 microns in size. Once again, remember, human hair is 70, the diameter of human. So these are very tiny particles. PM 2.5, this room contains lots of PM 2.5, except we cannot see it. As this room contains some PM10, but again, we cannot see it. So both PM10 and PM 2.5 are particulate matter in the atmosphere that we cannot see, but nevertheless, PM 2.5 has huge human health consequence.
Just a quick clarifying question. What will a particulate matter PM affects you how? How does a particulate matter affect a human?
PM10, both PM10 and 2.5 you can breathe. But PM10 gets taken out by the breathing system itself, which is the nose. But PM 2.5 particles are so small that then go down all the way down into the lungs and begin to interact at the cellular level. So that's the impact. And so PM, again, remember, PM 2.5, I have not said anything about its composition. What is it composed of chemically? It's composed of lots of different things. Depending on what it is composed of, it'll have a series of impact on human health. Okay, that's what it is. So nitrous oxide, once again, is a greenhouse gas, and it is full 72% is emitted by agricultural operations, and nitrous oxide is 300 times more powerful as a greenhouse gas than carbon dioxide.
So these are percentages of all the emissions in the U.S.?
Only in the U.S.
All the emissions comes from agriculture?
Correct. This is only associated with agriculture. That is correct. And I will calibrate you all of what is the amount that is emitted in the U.S. in just a minute in terms of ammonia. Odor. Odor is something different. People react to odor differently, but nevertheless, the odor remains unquantified in these operations, as is pathogens and VOCs, which stands for volatile organic compounds, or HAPs, HAPS, which stands for hazardous air pollutants. Hazardous air pollutants, by definition, are toxic, and they have an impact on human health, as you'll hear from the speaker coming after me. Nevertheless, these are all the different compounds that are emitted in large quantities in the U.S. atmosphere. So what are some of their consequences in terms of agriculture on air quality? So let's look at directly what is emitted. I listed a moment ago: ammonia, oxides of nitrogen, nitrous oxide, particulate matter, methane, VOCs and HAPs, sulfur dioxide and hydrogen sulfide, odor, pesticides, and CO2. But indirectly, what is emitted is, once in the atmosphere, what happens to it, or once in the soil, what happens to it, to the pollutant. You lead to secondary PM particulate matter formation because of the chemical reactions between different gases. For example, ammonia, basic gas, react to sulfuric acid and acetic gas to give you a particulate matter, PM 2.5. So that's a secondary emission associated with this industry. CO2, sequestered and indirect emissions of nitrous oxide. So when ammonia falls into the landscape through nitrogen cycling, it gets emitted back into the atmosphere as nitrous oxide, a greenhouse gas. And so let's look at some of their consequences. So I've tried to plot this. If you look at the different greenhouse gases, which in this case is methane and nitrous oxide, it accounts for about 15% of climate change, radiative forcing associated with greenhouse gases is from agricultural operations, which is a large amount. As an acidifying substance, the oxides of nitrogen, sulfur, and carbon, they account for something like 30% of what's in the atmosphere. Eutrifying substance, which means once they get onto the aquatic ecosystems, they lead to a host of different problems, amongst them being hypoxia, anoxia, and I will show you a slide associated with that in just a minute, and particulate matter. How much of the particulate matter, which has direct consequence on human health, is about 18% shown right here. So let's look at one of the hazardous air pollutants, and we went around sampling at various farms in North Carolina, and most of the results that I will show you are from North Carolina, is sample measurements of of hazardous air pollutants. So the pollutant that I have chosen is acetaldehyde. It's a hazardous air pollutant. If we breathe it, it has a direct human health consequence in terms of cancer. And so plotted in the light blue what is in the ambient air, and in the dark blue what is in the hog houses where these operations take place. So what we see here is from time to time we have values of acetaldehyde larger than the reference concentration. And reference concentration is put forward by the US Environmental Protection Agency, 10 parts per billion. If you're exposed to a hazardous air pollutant, in this case acetaldehyde, above 10 parts per billion, it will have a direct human health consequence in terms of cancer. So this pollutant is indeed emitted in the hog houses, and people are indeed exposed to it. So let's look at ammonia. Ammonia is the largest volume pollutant emitted in concentrated animal operations, and full 4 teragrams per year in the US is emitted by animal agricultural operations. Globally, the number is 75 teragrams, but nevertheless, in the US, it's 4 teragrams. 80% of all the ammonia is, if you look at this chart, oh man. If you look at this chart here, this entire piece of the pie right here is 80%. Non-agricultural operations, about 20%. And so look at dairy, 14%, beef, 14%, poultry, 15%, swine, 11%, and so on. But basically, ammonia is emitted by agricultural operations. So, what are some of the impacts of ammonia on the environment? It impacts particulate matter formation. We are finding out, and more studies that are being done corroborate that ammonia, the presence of ammonia leads to the formation of particulate matter fine, PM2.5. And if we can get rid of ammonia, we'll reduce PM2.5 in the atmosphere. Thereby, we will improve human health, certainly in rural environments, which can then contribute to exceedances of 2.5 and visibility degradation. It impacts dynamics of acid precipitation, as I will show you in just a minute. Nitrogen deposition and perturbs the nitrogen cycle and has an impact on climate, and I will show you that in just a minute too. And impacts on groundwater and odor. So let's look at PM2.5. Here is, here is North Carolina right there, North Carolina. And I've looked at 2 cases. And this is where animal agriculture, hogs are grown in North Carolina right there. So I've looked at 2 case studies. In one case, looked at the air masses that came to this location from the west, and in this case, coming from the east. When they come from the west, they come Ohio River Valley, or this power plant located outside of Charlotte, bringing in sulfur dioxide. In this case, when they come from the east to the location, this is where during summer is the visitor, the tourist season is, and lots of cars producing lots of oxides of nitrogen. So that's this region here. And in these 2 different regimes, what we see is case 1 when the air mass is coming from the west, case 2 when the air mass is coming from the east. We do produce total amount of PM2.5 approaching the NAC's daily value of 35 micrograms per meter cube. So indeed, in presence of ammonia, the PM2.5 enhances considerably, and we need to be aware of it, even in rural operation, air. So let's look at ammonia impact on nitrogen deposition. And in terms of nitrogen deposition, you can see 2013, based on there's an organization, National Acid Deposition Program, that monitors for rainfall and chemistry of rainfall. And so you can see large amount of ammonia being deposited where the agricultural operations are. This is Midwest, this is North Carolina, and this is California. That's where agricultural operations are. And when this, all the nitrogen flows from here into the Gulf of Mexico, you can see algal blooms taking place, which is one of the speakers in the early morning talks talked about how this nitrogen flowing through the Mississippi impacts this region right here. And one of the other consequences is in North Carolina, it leads to over-enrichment of water, leading to fish kills, and so. So let's look at the impact of ammonia on climate. I'm almost done. Enhanced nitrous oxide formation, impact on organic aerosols, which absorbs more radiation coming from the sun, so it will enhance climate change related issues. And lastly, impact on cloud formation through particles. So let me try to
I've got a suggestion, which is we let the other speakers speak, and I think everybody in the room wants to see what's happening here, but we have other folks to speak. Can we bring it back at the end, and if folks want to stay on, which you might, this is an incredible presentation. It's drawing a straight line in my mind with the some of those things that we really need to externalize costs.
So
how many slides do you have?
I'm going to take 1 more minute and I'll be done.
1 moment.
Okay. So looking forward, what can we do? Looking forward, what we can do is try to mitigate the emissions of trace gases into the environment. And indeed, while...
Well, let's hold that thought, because I'm going to ask you what we can do. Thank you so much. I'm not trying to put you off, but I want you to come back when we talk of solutions. An incredible presentation, and thank you. I think even those of us that are buried in this on a daily basis are like trying to get hold of your presentation now so that we can just put it online and resolve a few arguments. So with that in mind, what we're trying to follow here is the journey of the externalized costs. And I know, Dr. Lyerly, you've been working directly with some of this research and some of the implications that this particulate matter and others can have. And again, we're dealing with another incredible scientist who was working with, has been working in the area of cancer, is on the National Cancer Advisory Board, University of Michigan, University of Chicago, University of Alabama, and the focus is the effects of the environment on human health, particularly the association between poor air quality and respiratory illness. And we're going to hear again how some of these gases that are escaping from some of these confinement operations, and I want to be really clear, there was a piece up there about beef. Pasture beef doesn't give off the amount of gases necessarily that a confinement beef operation might.
Thanks. Well, again, great talks this morning. What I wanted to do was try to bring together some of these environmental issues and bring them to human health questions. And I've done a lot of things. One of the programs I run now is a program called Environmental Health Scholars. And what this program does is it tries to bring disparate scientists together, but also policymakers, lawyers, NGOs. Can you guys hear me? Okay. So this Environmental Health Scholars program brings together the disparate scientists on campus and off campus, NGOs, Southern Environmental Law Center, et cetera, et cetera. And again, before I get to the end of my talk, I want to just, again, reach out. There's no way I'm going to cover everything and no way I can touch upon all of the details, but I really want to extend an invitation to people who are interested, colleagues on the panel and so forth, to continue the dialogue and discussion, and we'd love to continue to work together. Let me tell you what we're trying to do, and this is work I've done in conjunction with Julia Kravchenko, who is a faculty member at Duke. So one of the questions that we were asked is, what are the health effects of these hog farms? You've heard the smell, you've seen the pictures, you've seen the wind blowing and so forth, and it sounds terrible. It sounds like a horrible place to live. The guy's wearing the gas mask on his front porch. But what are the health effects? And there have been reports of health effects, but oftentimes these are single studies, depression and fatigue, maybe stress-induced impact on your immune system, maybe more asthma, as you could imagine, the air quality being different. Some here pulmonary function and maybe neurobehavioral things. Here's one that studied acute blood pressure. So there are these dribs and drabs coming in about health effects. And one of the things we were aware of is that there's an increasingly large amount of environmental data that's being generated, again, from satellites, from reports. There's also an increasing amount of health-related data that's being generated from healthcare systems, from reportable diseases, from county health. And the idea was, can we develop an infrastructure to marry these databases and to get some idea of what's going on by looking at environmental factors and health factors? And these types of analysis are different because the kind of data that exists today didn't exist 5 and 10 years ago. It's just the same way if you go into a supermarket and they ask you what kind of ice cream you like because you keep buying ice cream, or your smartphone tells you about the Hawaiian vacation deals coming up because you've been searching on Google for Hawaii, right? So there's a lot of information out there, and our thinking is to create a forum to take advantage of that information, and this is an example of that. I'm going to show you some data that we haven't published yet, and again, it's in the spirit of trying to share data, to share preliminary data, to trigger relationships and to extend those things without waiting 2 years to publish them and so forth and so on. So, the caveat there that this is unpublished. So we wanted to determine the impact of the CAFOs on nearby residents. In North Carolina, the majority of the CAFO problem is with hog farms. And we talked about beef, and beef, I guess beef make a lot of beef waste, but hogs are the world's champions of making waste. And they make 20 to 25 times the waste of a human. If you have a population of millions of hogs, it is like having a city of 25 million people, but there's no waste management. It's not required by law. So all of this stuff gets poured into these ponds and sprayed around. It sounds really, really, really bad, and you know this. So the question is, so what are the health impacts? Well, one of the things I'm going to tell you is that what we end up doing is we measure bad health. We measure death rates and hospitalizations and emergency visits. And we would like to measure good health because we like to compare, if you don't have a CAFO, your health must be good. And so, maybe good is not that. Oddly enough, we're not very good about measuring good health. And so a lot of the details we have are detrimental health effects like mortality rates and so forth. So we'll again, just have to accept that. So data sets we used, health characteristics of residents in North Carolina, about 10 million people in the state. So it's not a small state. Environmental factors, these are publicly available or reported through the U.S. Environmental Protection Agency. And then we wanted to use cofactors, socioeconomic characteristics, adult smoking. Again, these all affect health. And so what did we do? There's 100 counties in North Carolina, and what we did is we mapped out all of the CAFOs and the populations of hogs, and that's mapped here on this heat map, if you will. Those populations of hogs that are above 100,000 per county, up to 2.4 million hogs, versus no registered hog farms in the county. And what we did is we took the 17 counties that had greater than 100,000 hogs, and this covered about 1.5 million lives. And the control group was the 40 counties that don't have any registered hog farms, about 3.7 million lives. So this isn't comparing 12 people who live down the street from a hog farm to another 15 people. This is millions and millions of people, and this gives us, again, that kind of big data sense that these are real observations that are occurring. So we compared the health outcomes of the 17 counties with this CAFOs versus the 40 control counties, and again we looked at health outcomes. We corrected for number of hogs, and actually we have corrections for the actual airborne ammonia levels. This is work that we've done in conjunction with North Carolina State. We're analyzing these and adjusting for age, health insurance, household income, smoking prevalence. What's interesting in North Carolina, they have a pro-business or Republican governor now. He doesn't seem pro-business with this new health, this bill that he passed, which was so incredibly bad. But one of the problems with the state is that there are laws about taking photographs of hog farms. And so to get access to some of this public data, we had to publicly disclose that no information is requested to identify any individuals. And we also have to say no attempt was made to locate a specific farm based on the ammonia plume. And again, otherwise we couldn't get access to this data. Again, we talk about policy, but how can we get access? How do we get information that's particularly impacting our health? So characteristics of this, we heard a little bit about this issue. 1.5 versus 3.7 million people, male and female population. And this is where we start really beginning to see differences. What's the racial population? The number of whites in the counties with hogs is much less. This is the African American population, American Indian, Asian population is a little bit less. But again, this is the sort of the socially economically disadvantaged populations here. Again, age differences, not too much, but really we're seeing poor whites, poor blacks, Hispanic populations living in these counties with the hog farms. So what did we find? And as I said, this is unsubmitted, unpublished data at this time. But you heard that hog farms have higher infectious disease for workers and for local residents. As we expected, we confirmed that there was a 30% increase in emergency room visits for infectious diseases, an increase in the number of infectious diseases-related emergency visits with an odds ratio of 1.17, and an increase in hospital admissions, modest odds ratio of 1.03. So what was satisfying about this is that we did this big analysis of 5 million people, and we saw from this population level analysis the same trends that we would expect, right? If we didn't see this, we would say, well, maybe there's something wrong with our modeling or our system and so forth. So we were expecting to see higher rate of health-related infectious complications, and we saw that. So we're happy with that. What else? We heard about air quality and these ammonia plumes. Well, there's an increase from respiratory diseases. As expected, we confirmed there's a 20% increase in the emergency room visits from acute respiratory diseases. Emergency room visits as a percentage of all ED visits, and in hospital admissions are, again, modest, but again, a 1.16 odds ratio. So again, we're pleased that for what is generally accepted to be the complications of living around a hog farm, infections and respiratory problems were there. But again, what we're telling you is that we're taking a global view. We're agnostic. We're saying, well, maybe there's an association with diseases we don't even know about. What about those types of things? By taking an approach like this, we can look at things like that. So hypertension had been considered related. There had been one report about hypertension associated with hog farms, maybe anger, or you're mad at your neighbor for having this horrible hog farm. But what we found, it was, again, a 30% increase in emergency room visits for hypertension, an increase in cardiovascular disease emergency room visits, 1.3 odds ratio, and an increase in hypertension-related hospital admissions, again, pretty significant, 1.2 in the odds ratio. Now, here's where we really think that there's a real value in using these big data types of analysis. We also found that there was an increase in mortality. The death rate from cardiovascular disease was higher in these counties that have hog farms in them. And again, if you look at the population here, and this is what's so key about the population analysis, younger people, not such a big difference. The blue is with hog farms, red is without hog farms. But when you start getting into the elderly, the more vulnerable populations, you see a pretty significant difference, a pretty big difference in the 70-year-olds that have, perhaps some marginal heart reserve. They're in this hog farm. Their death rate is going to be higher than if they're not living near a hog farm. And again, the very similar types of patterns with diabetes, same type of a narrative here where we're also seeing a 70% increase in ED visits, mortality for those at risk, 76-year-olds, a greater mortality from diabetes in these populations, kidney disease, again, very high hospitalizations as well as mortality. Again, the key thing is when you think about many of the CAFO-related health studies, they measure the health effects on the workers on a hog farm. Now, if you're 70, you're not going to be working on a hog farm. I mean, you're going to be like, teetering around. And the problem is that the magnitude of the health effects, if you're a healthy worker, are probably not as great as if you really, you have a chronic disease, you have hypertension, you have a little bit of diabetes, and these are the vulnerable populations. So again, as I said, we were trying to take a new approach to look at health effects. We think it's going to take a lot of commitment from a lot of people with an interest in trying to understand the social cost of these CAFOs in this context, but we're looking at other environmental relationships in North Carolina and beyond, and we'll continue to do that. But we thought it was quite interesting to see the magnitude and the breadth of health effects from these CAFOs. We also wanted to point out that our study includes the vulnerable, such as children, those with chronic disease, and the elderly, which are often missing in the industrial analysis of workers at at these CAFOs. And an appreciation of this vulnerable populations living in proximity to the CAFOs, perhaps not working there, is really needed to gauge their true health impact. Again, I wanted to acknowledge Julia Kravchenko, who's done really most of the work, and other collaborators at Duke. Thanks very much.
Thank you. And an amazing direct line again to some of the externalized consequences of some of the CAFO production. I think none of it's things we can't deal with, and I think we have to be really clear. The farmers, that's a good noise. We have to be clear, the farmers themselves didn't design these systems. Most farmers are told in these systems to farm in the way they do, and in fact have contracts to force them to farm in the way they do. So moving through the various areas of things or folks that are being affected, just to now look at some of the animals in terms of the issues for the animals in confinement feeding operations. Leah Garcés is the U.S. Director of Compassion in World Farming, which is a sort of European start animal protection organization, but an organization that is now broadening its wings into a global organization looking to move the needle on food animal welfare. Leah's worked for 15 years to advance animals in agriculture and is working predominantly, I think I'm right, on working with larger organizations, corporations, retailers and others to move the needle on their supply chain to the benefit of food animals in that supply chain. Leah, thank you.
Thank you, Andrew. I want to thank all of my speakers before me. They are a hard act to follow, I have to say. How's everybody feeling in this room? Are you chicken? Can you flap your wings? No? Okay, well, they purposely put us in this room, in a very small room, so that we could be very empathetic and sympathetic to the cause that I'm about to speak about. I want to also thank all of you in this room, because I know all of you are here because you care about this issue and you want to make a difference, and that's what I want to do too. And I hope that you go away today thinking that you can, and I'm feeling particularly optimistic during these times when we're making such great strides and such change, so thank you. Now, the reality of factory farms we've heard from these speakers, but for a second I want us to remember who are in these farms. And of course, the reality for those animals is quite a grim one. And that much is obvious when we look at these pictures, whether it be for the broiler chicken who can no longer walk because he's too big and collapses under the weight of his own legs, or whether it's the sow who is pregnant and is trapped in this crate where she can't even turn around, or it's the laying hen who cannot flap her wings and is trapped in a cage as well. That's really obvious. When we look at those pictures, it's a moral obligation that we feel for these animals. And they are sentient beings, and they can feel pain, they can suffer, they have needs and wants, as Andrew pointed out, and we have an obligation, if we're going to use them in our food system, to give them a life worth living. And that's something that's front and center to us if we look at these pictures. And we think about our dogs and cats, and pigs and chickens biologically, physiologically are the same. We've just chosen one that can go on our bed and one that can go on our plates. But we have another obligation, and it's the purpose of our food system. Anybody want to guess what the purpose of our food system is? Feed people, right? That's what it's supposed to do. But we have this. This is a picture I took on a road trip this summer, and I was glad somebody brought up the dead zone earlier today. It was a trip that I took earlier, which I'm going to speak a little bit about. We have an obligation. 1 in 5 people, children in our country, go to bed hungry every night. In fact, there's 1 billion people globally that go to bed hungry every night, nearly 1 billion. And that's a harsh reality, and it means we have to take a cold, hard, analytical look at our food system. And what I hope you go away with today is knowing that if we were to start again, if we were to start from the beginning, from scratch, we would never choose factory farming as a way to feed ourselves. It is the most inefficient, unsustainable, and inhumane system we could have possibly come up with. And we have to accept that, and we need to change that. Because we are faced with this. How are we going to feed 9 billion people in the future? Are we just going to carry on? Are we just going to keep doing more of the same? If this was a business model, it would be bankrupt. And that's what we're faced with factory farming. And we need to accept that, and we need to think about the impact it's having. So I want to we only have a short amount of time. I could talk all day long, and for my poor friends and family, I do talk all day long about this. But I'm going to take one little aspect that I think we can do something about, and we need to do something about. Feed. Feed is a hidden cost in our food system related to factory farming. In fact, an area the size of the entire EU is what we use of our arable land, our precious arable land, to feed farm animals in factory farms. And when we're thinking about feeding 9 billion people in the future and how we're going to do that, we need to take a harsh, cold look at how we're using our arable land. And agriculture is the biggest use of our land, and we can no longer afford for it to do one thing, which is what it's doing for the most part. It's just feeding factory farmed animals held in CAFOs. And we need to look at that. This is a picture from I'm sorry the lighting is so poor, but that mass of dark color there is actually they're beef cattle that are kept in a feedlot, and they're about ankle deep in their own manure. And instead, and you can see in the background, which I think is so harsh for them, is there are pastures. There's beautiful land all around them, and instead they're confined in these CAFOs. And do you know what that beautiful land is being used for? To grow food for them, to grow soy, to grow maize, to feed them, to keep them in there. It seems like something's wrong with that it must be a crime that instead of, letting these animals be on pasture, we've somehow kept them in a feedlot and then grown their feed somewhere else. And that seems inherently incorrect. And it also seems inherently incorrect, if you think about it, that we're using all that land to feed them. And I'm going to take you on a little tour. Our CEO wrote a book called Farmageddon, which is a travel log from around the world. And I'm going to take you to 2 countries he visited. One was Argentina. I was looking at the impact of feed around the world. 1/3 of all of our cereal in the whole world is used just to feed factory farmed animals. And this is having quite an impact because it's using our arable land, it's using our water to feed factory farmed animals. But it's also having an impact on the local populations there. In this particular case, there's a family here. What happened about a decade ago in Argentina is the land was taken over to produce soy that's exported around the world to feed factory farmed animals in China, in the United States, and all around the world. And it is a very intensive production, soy. It's full of chemicals, and there's no laws there to protect the people. People were marginal. These are already poor people who were marginalized from their land that they've been living on for generations and generations. And the result is quite astounding for their health. And I'm not a health expert, but I do know that cancer rates are higher there. There's asthma. There's been increases in miscarriages. I think these folks could probably speak better to that. Another spot, Peru. One thing you might not realize is how much fish is being used to feed factory farmed animals. In fact, one third of all the fish caught in the world is used just to feed factory farmed animals. And in this particular place, Peru, on coastal Peru, it's anchovies. They are being fished all along the coast. So not only has that had an impact on the coastal population of humans, it's had an impact on the coastal population of birds. And since the 70s, there has been a 95% reduction in bird population in coastal Peru because of this. Peru is also the second largest fish meal producer. And they are exporting around the world. Fish meal is a horrible, horrible, disgusting, filthy, has a filthy method of production. And you can see the sludge that's coming out of here. And that sludge, it gets into the waterways, but there's also terrible air pollution. And in the area, there is a very high incidence. It's in the town of Chimbote, where this fish meal is being produced. Approximately 70% of the children have skin lesions as a result. And as you get in a 1 mile radius of the particular factory, about 90% of the children have skin lesions. So we're using our land, we're using the fish, and it's all being used to feed animals that are kept in those pictures I showed you earlier. We've really taken a wrong turn here, obviously. And we still have to answer this question. And that's what we're here to do, right? We still have to answer, how are we going to feed 9 billion people? And clearly, now that we know everything we know, I wish we could get every CEO of every food business and every senator and every House of Representatives in here to talk about this and learn what we're learning, because they would realize how pressing this is. But here's the good news. The UN has started to realize how pressing this is, and they've started to try to answer this question about feeding the world. And they asked this question. They said, how many more people could we feed if human edible crops were used for humans instead of for animals in CAFOs? Anybody want to guess? Any guesses? Another 10 billion? Not quite, I wish. Man, that would be great. It's around, so if we were to take just half of the land, we could feed 1.75 billion people. And this is coming from the United Nations. They are investigating this because we have to think about the future of our food. And if we were to take all the arable land we're using to feed factory farmed animals right now, we could feed 3.5 billion people. That is a number we cannot ignore, and we need to think seriously about as we move forward and try to determine how are we going to have a future at all if we don't have food. Now, there's a whole other panel talking about food waste, and so I wasn't going to try to repeat that, but I don't want to ignore how much food that we are wasting. And think about those pictures I showed you at the beginning. When you think about the number of animals that are actually thrown directly in the trash and that are living a life of suffering only to go in the trash. And they asked this question as well, the UN. They said, how many more people could we feed if we just halved our food waste? In the United States, we throw away half of our food. Globally, it's about a third. They said 1 billion if we cut it by half, and 2 billion if we cut it 100%. These are real answers to the problems that we're having today, and we cannot ignore these numbers. And why can't we ignore these numbers? Because of him, because of her, and because of them. So I want to leave you with those images and those questions that I hope will help you carry on with your fight. And I thank you for your attention.
Leah, thank you very, very much. Leah spoke a little bit about water, and it was really interesting this morning when Jonathan Foley stood up and talked about the export of water, and that was a phrase that sort of got me thinking, and Leah just very quickly encapsulated what we're talking about. When we grow corn and soya in one watershed and we ship it from that watershed to another watershed, we are exporting water from that watershed. So there is a direct correlation between confinement feeding and the movement of water. It's not just the water we see being irrigated, and Jonathan was quite humorous in terms of how do we get rid of as much water as we can. We use pivots. We use them in Oregon a lot, but we grow great carrot seed. But we are exporting a lot of water from one watershed to another watershed in the back of a truck in the form of corn. And then we're feeding, and this is a really interesting fact, humans are more efficient at turning grain into protein than chickens are. So why feed grain to a chicken to feed it to yourself when we're more efficient? I'm painfully aware in my life that I have a great life. I live in a house. I have 2 kids in college. I can pay my food bill on a regular basis. And I'm not too impacted by anything. But one of the things I think missing from this particular conversation is people of color. People who could be impacted by some of this work. And I met somebody many years ago, he just finished filming, a gentleman called Sanjay Raul, who wrote the film or did the food change, and I just wanted to hear from him really briefly on one of the other externalized costs and perhaps the hidden voice that we need to be listening to, just for a very quick minute. And if you haven't watched Food Chains, it's an incredible film to watch, because there is a whole sub-society in food animal production that isn't being paid properly. But more importantly, good food is a right, not a privilege. Everybody has the right to eat well and to eat food that is good for them. And Sanjay, just could you talk to us a little bit from that aspect, if you don't mind?
I'll be really brief, and thank you, Andrew, and thank everyone here. I mean, I'm like everyone here. I'm a card-carrying member of the food elitists. You know, we all eat well. We're all, you know, we don't have many wants. And in conferences like this, there seems to be a bifurcation between the idea of sustainability and social justice. Apparently, social justice is kind of a bad thing to talk about. They're poor people. They're people of color, and that's why in this whole conference, you know, most of us either come from the same genetic stock or the same socioeconomic class. Everybody here, if they don't all look the same, they all kind of talk and they eat the same. Joanne Lowe was in here for a few moments from Food Chain Workers Alliance, but out of 1,000 of us, there's 1 or 2 people that represent labor. I'm by no means a representation of labor, but I had the opportunity to work on my last film with Barry Estabrook, who recently wrote a book called Pigtails about factory farming, and Eric Schlosser, who wrote the book Fast Food Nations. According to them, there's no worse job in this country than working in factory meat production. In CAFOs, you know, workers are literally knee to waist deep in hog slurry, like hog shit, literally. And the environmental ramifications and the externalities and the socioeconomic costs of bearing the burdens of factory farms is huge. And it's something that I think is ultimately what convinces us not to participate in these food systems, that we can somewhere down the road be affected. But again, there's 500,000 workers in the United States who are people of color or undocumented workers or are yoked under the H-2A visa program that are bearing the brunt of 99.5%, making this up totally, of course, 99.5% of all of the environmental ramifications, economic ramifications are faced by these people whose lifetimes longevities are cut way down. They're getting paid less than, you know, a living wage, and they're the ones who are missing from these conversations, mainly because it's really hard to study. It's really hard to get access to them. It's a moral issue much more than it is a data issue. But people in the animal rights movement have actually done great work to literally show the associative relationship between farms that treat animals well and the impact that treating animals well have on treating workers well. So again, I don't represent workers by any means, and I'm grateful to Andrew for bringing this up, and everybody touched on it. But again, it's like, one of the reasons not to participate in this type of agriculture is because it sucks for the workers. Not just that it sucks for me or sucks for people who live around there, but for the people who are farming the meat. It's a terrible industry to be in. Thank you.
No, Sanjay, thank you so much. What we're going to do now is just sort of, I want to thank the speakers. We are going to run your presentation again at the end so we can get it all on film. I thought it was immense. But then just move into anybody that has any questions. And I just want to finish up by popping along the panel and asking them what some of the solutions might be. Because our agricultural system today does seem a little dodgy. There's something that's not quite right about it. But what can we do to fix that keeps food affordable, that keeps food accessible, and stops food being elitist and exclusive? And I'm reminded that when I walk around California, particularly San Francisco, and I'm seeing people sleeping on the side of the road. How do we feed those people? How do we get those people good food? How do we get access to nutrition that's meaningful for them? So if I may ask everybody to put their hands together for the amazing presentation of our panelists. And if you do have a question, if you could just sort of say your name. Oh, and by the way, sat in the front is Douglas Gayton, who did the amazing chicken presentation that we all saw that's going live. So welcome, Douglas. Sorry, you've got a quick point.
Something to what Sanjay said. Thank you for your comments. They were really great to hear. I think one thing that people tend not to recognize about workers in CAFOs is that the majority of them are not covered by oversight from the Occupational Safety and Health Administration. So these operations typically employ a very small number of people, and because they don't meet some threshold, OSHA doesn't consider them workers at all. So they're not afforded any of those protections.
So did I have the I think I had. So if you could just let us know who you are.
Okay, thank you. Hi, thank you all for your very interesting words. My name is Anita. I'm from Chile, and I came to this conference especially. I'm a food blogger, and I write about food sustainability, and I'm starting also the food sustainability movement in Chile. And I wanted to ask Kendra a little bit more about what your organization does when CAFOs gets to town. We've had issues in Chile with major CAFOs that have been stopped and through violent conflict. And how do you work with the community? Like, what's your objective? Your objective is to get the CAFOs out, to stop them, to and how do you kind of engage with the community? Basically, how does it work?
Thank you for that question. So our organization, as I mentioned, we have this team of people, and they're all experts in some area. And typically what happens, this isn't always the case, but typically what happens is we get a panic call on a Friday afternoon at 5 o'clock from a community that just found out that there is a new hog CAFO that's proposed, and the hearing is next Tuesday. And so our goal is to stop that facility from ever being built, because once it's there, it's really hard to shut down. We have been successful in shutting down a couple of facilities across this country, but those are definitely anomalies. So and right now I should also say we have 140 active on the ground CAFO fights in about 30 states. So there's a lot going on right now. Basically what we'll do is first, the laws in the United States are different from state to state, and sometimes even within the state, they're different from county to county. So the very first thing we have to do is we have to figure out what is the trigger to stop the facility, and then we work with the community and organize around that trigger. So while that's happening, we have engineers poking holes in the permit, because sometimes what will happen, and we see this all the time, is that these facilities will use boilerplate permits and just change the names. And so if you're an agency person reading this permit, you might not be an engineer. You might not know how to do the equations to actually say, well, wait a second, your waste management system doesn't fit for the amount of waste that your facility is producing. So we have an engineer that goes through and pokes holes in the permits, and then we provide the community with the tools to basically challenge the permits. Sometimes we're successful, and sometimes we're not. And so when we're not, what we do is we try to equip the communities with tools so they can hold the facility accountable. We teach them how to do water monitoring. We teach them how to do air monitoring. We teach them what their rights are under the law. There's Freedom of Information Acts that state agencies have to give them information. And then we'll set them up with some local counsel so that if they have to take legal action, they have some counsel to help them.
And I'm sure if you meet with Kendra afterwards, she can give you more information. Douglas.
Just a quick follow-up question.
a quick follow-up question. Douglas Gayton from Lexicon of Sustainability. So I went to Hickman. You forced me to go to Hickman. And that poultry operation was originally in Glendale, which is right outside of Phoenix. And they moved because of all the problems they had with the community. In the time I spent there, the thing that boggled me most about that story was they've been trying to battle, with your help, that poultry operation. And it's a company that alternately is an industrial company and then an agricultural company, constantly redefining themselves legally to circumvent all of the environmental, all of the air quality laws. And I wonder, we talk about all of the impacts of all of your extraordinary work that you guys are doing, for example, in North Carolina. But the thing that really struck me most about Arizona is how facile these operators are and how really it doesn't seem like there's any legislative mechanism in the state of Arizona to even control Hickman.
Does anybody want to?
I'm happy to comment. I think you're absolutely right, and I think one of the challenges with the CAFO industry across the country is that they've been really, really good about padding the pockets of politicians so that there will be no legislative fix. The case with Hickman's in Arizona is a very powerful family. They provide the eggs for the governor's egg roll every year. There are family members that are strategically placed in all sorts of political positions from the very county zoning level all the way up through state legislature. So we can talk about these issues, you're absolutely right, but when you have the government controlled by this industry, it makes it very difficult to go through and find a legislative fix.
Thank you. I think Oswald, you had one.
Nate Cornell, and I had a question for Dr. Lyerly on your study, which was very interesting, the health impacts of the CAFOs. And one thing I noticed during your presentation is that many of the negative health impacts of the community CAFOs were similar to the same negative health impacts of just people who live in low-income areas in general, asthma and hypertension, higher mortality rates. So how did you control for that in your study?
Right, so great question. So those types of studies they control for socioeconomic status, race, ethnicity, and so you match all of those things to those other 3.5 million people. But again, I think one of the things that we're trying to do is also explore ways to create more granularity. So that was at the county level analysis. We are now looking at the zip code level analysis. So there's tens of thousands of zip codes that represent populations, and you get a lot more precision. You need to do more mathematics because event rates within a zip code, you might have to compress them and so forth. But the other thing we're really trying to take advantage of is the temporal dynamics of change, right? So we're really interested in CAFOs that start because you could look at the 3 years before the CAFO got started and the years after that, and can you see a dynamic change in the event rate, in health effects, mortality due to that, and that has been very convincing when we have either legislated or administratively challenged CAFO operations, and that gets to the point of tangible damage. So when you think about the smell, or it's awful, and this old guy can't sit on his porch anymore, and it's compelling, but from what we understand, and this consortium of people that work together, there's a group called the Southern Environmental Law Center that really focuses on, taking action in which tangible damages occur. So that smells bad, it doesn't seem that's like nuisance law versus, there's a tripling of the death rate from heart disease. That seems to be a more tangible damage to an environment. And so they've have been in the process of trying to get more granular, trying to give us feedback to say, well, how do you know it's not some trivial thing? It's the phases of the moon. It's, smoking rates went up. The e-cigarette came out, and that's why these things are happening. So I think it's a dynamic, but I think it's this collective view of how best to use information, how to develop quality conclusions from the data that exist. So thanks for your question.
Thank you. We're going to take 2 more questions, and I'm sorry about the time, but we are definitely out of time, and it's beyond everybody's control. So another question.
Is this on? Can you hear me? I would like. Okay, I hope that wasn't me. I wanted to know if there are legislative opportunities or policy change opportunities that are coming up that we should know about, or that we could, as organizations or individuals, get involved in. I think particularly anything related to animals, it's often very weak and greenwashed, and it's really just bullshit a lot of times. So what suggestions do you have for people here and the people that we work with that we can share that information with?
Yeah. Is this on? Yeah. So particularly around animals, we have something really exciting coming up, which is the Massachusetts State Ballot Initiative. And that is going to be where in November, anybody who's from Massachusetts will be able to vote to make it illegal to close confinement of animals will become illegal. So cages, crates will be out. And furthermore, the sale of products direct to consumers also will be out. And that is, we're gearing up for that. If you are interested, it is, I forget, does anybody remember the name of the website? Citizens for Farm Animals. Anyway, look up Massachusetts State Ballot Initiative for Farm Animals. We succeeded on getting it onto the state ballot in the first place, so that took a gathering of signatures. Enough was secured, and now that state ballot will happen in November. So if you know people in Massachusetts, get them signed up, get them geared up, and we are always looking to get state-by-state ballot initiatives approved so that we move these out of our food system. Obviously, California is a great example where that's already happened.
Just really quickly, I mean, Food and Water Watch are a great resource to look at for what's going on in terms of those sort of things. You can look at the Center for Food Safety. They do a lot of balloting. There's a couple of things happening around the organic regulation. They'll be going out for comment shortly. Although they're a really good start, they do leave a lot to be desired, so they need to be pushed really, really hard. But Rekha, can I get back to, so we've got one last question, and then I'm going to ask each one of you what we can do to make this a little better.
Yeah, actually mine sort of built on that. My name is Monique from Greenpeace International, and I just wanted to ask, obviously these CAFOs suck, we all agree. So one question, what's the Achilles heel that you each see of the CAFO? What do you think is the Achilles heel? And 2, how do you think we tackle that Achilles heel?
One sentence, each answer. Pass it along.
The Achilles heel, in my opinion, is that the animals are in confinement. Advocate for getting the animals out of confinement and on pasture.
Very close to that is reduce animal density.
The Achilles heel in my case is the solution to pollution. The solution to pollution is dilution no longer applies to CAFOs, so we need to be thinking of other paradigms to solve this problem.
So I don't know the answer. I think the solutions are going to be found in asymmetrical and in unexpected relationships. So like one of the things we're doing, we're taking the human DNA sequencing stuff we're doing, and we're looking at DNA from people, and we're mapping them back to DNA from the farm. So tangible evidence that your bacteria is coming from the farm and your diseases are related to that. You know, you talked about some of the diseases there. I didn't tell you a lot. There's some very interesting diseases that are not typically associated with poor people, and those are very interesting. So there's a lot that, but I do think it's meetings like this, interactions that are going to be the path forward.
For us, progress in the last 6 months has been around corporate policy, and in particular presenting animal welfare, bad animal welfare, as a risk, good animal welfare as an advantage, and playing off the companies, making this a competitive advantage. You treat your animals poorly, your investors are not going to stay with you, and your customers are not going to stay with you. So presenting CAFOs and continuing down this track as a risk for business.
From the perspective of a certifier that's working with 1,500 farms and across 3 million acres, the one thing you can all do is get educated. So get on websites, find out what the issues are, and the other thing you can do is educate other people. It's a big issue communicating what the challenges are to other people. This is an echo chamber. I know 80% in this room, I see you quite regularly. It's how we get that message beyond this echo chamber. So I'm sorry guys, we've run out of time. We are going to ask you to redo your presentation so it can flow, if you don't mind. So if people want to see that presentation again, we're going to try and film it from start to finish, because I think you were the only person I had to cut off. But ladies and gentlemen, what an incredible panel, what an incredible afternoon.